Hello everyone, my name is HUANG Ruibin. I'm a radiologist from the First Affiliated Hospital of Shantou University Medical College. Welcome to the medical imaging class. Today we will discuss typical imaging findings of cerebral venous thrombosis, CVT. Cerebral venous infarction is an uncommon form of stroke and is most commonly secondary to cerebral venous thrombosis, and patients may present with hemorrhage. It should be considered as infarcts with or without hemorrhage which do not correspond to the typical arterial territory. In some cases, it is a difficult diagnosis because of its non-specific clinical presentation and subtle imaging findings. Today, we will discuss the typical imaging findings of CVT. Upon completion of this session, students should be able to describe the typical imaging findings of CVT and make a differential diagnosis of pitfalls that mimic venous thrombosis. Cerebral venous thrombosis occurs in descending order in the following structures: major dural sinuses, superior sagittal sinus, transverse straight and sigmoid sinuses, cortical veins, vein of Labi that drains the temporal lobe, or vein of Trollard, which is the largest cortical vein that drains into the superior sagittal sinus, deep veins, internal cerebral and thalamostrate veins, and cavernous sinus. Venous thrombosis are typically seen in parasagittal structures, following sagittal sinus thrombosis, temporal parietal regions, transverse sigmoid sinus thrombi, or deep structures. This is an illustration of the territories of the venous drainage. There is great variation in these territories, and the illustration should be regarded as a rough guide. Students should keep in mind that infarcts with or without hemorrhage which do not correspond to the typical artery territory. Clinically, patients with cerebral venous thrombosis present with non-specific symptoms ranging from headache to seizures and common in severe cases. In neonates, shock and dehydration is a common cause of venous thrombosis. In older children, it is often local infection such as mastoiditis or coagulopathy. In adults, coagulopathy is the cause in 70% and infection 10% of cases. In women, oral contraceptive pill and pregnancy are strong risk factors. CT and MR are the common imaging modalities to diagnose CVT. Magnetic resonance venography, MRV, and computed tomography venogram, CTV, are excellent for general overview of dural sinuses and cerebral veins, while digital subtraction angiography DSA is best for detailed delineation. On a routine non-enhanced MR or CT, you should think of the possibility of venous thrombosis when you see the following signs: direct signs of a thrombus, infarction in a non-arterial location, especially if it is bilateral and hemorrhagic, cortical or peripheral lobar hemorrhage, cortical edema. Direct signs indicating thrombus include dense clot sign, empty delta sign, and absence of normal fluid void on MR. The image shows the dense clot sign and also the dense triangle form hyperdense thrombus within the superior sagittal sinus on CT. However, we have to keep in mind that normally veins are slightly denser than brain tissue. Therefore, in some cases, it is difficult to say whether the vein is normal or too dense. So, a contrast-enhanced scan is necessary. It is seen in only 1/3 of cases. Visualization of a thrombosed cortical vein that is seen as a linear or cord-like density is also known as the cord sign. Another term that is frequently used is the dense vessel sign. This non-enhanced CT shows the dense clot sign in a thrombus cortical vein. These images show us this patient with a hemorrhagic infarction in the temporal lobe due to the thrombosis within the transverse sinus, which appears as dense clot sign on CT. The empty delta sign is a finding that is seen on a contrast-enhanced CT and was first described in thrombosis of the superior sagittal sinus. The sign consists of a triangular area of enhancement with a relatively low attenuating center, which is the thrombus sinus. This case showed us empty delta sign due to thrombosis in the superior sagittal sinus. This is a case of thrombosis of the right transverse sinus and the left transverse and sigmoid sinus. That is enhancements surrounding the thrombus hypoattenuating veins. On spine echo images, patterned cerebral veins usually will demonstrate log signal intensity due to flow void. Flow voids are best seen on T2-weighted and flare images, but sometimes can also be seen on T1-weighted images. A thrombus will manifest as absence of flow void. Although this is not a completely reliable sign, it is often one of the first things that make you think of the possibility of venous thrombosis. The next step has to be the contrast-enhanced study. In this T2-weighted image, we can see normal flow void in the right sigmoid sinus and jugular vein. The other sign that can help you in making the diagnosis of unexpected venous thrombosis is venous infarction. Venous infarction usually results from venous sinus thrombosis. Risk factors include the number of states that result in hyperviscosity or increased coagulability. Venous thrombosis leads to a high venous pressure, which first results in vasogenic edema in the white matter of the affected area. When the process continues, it may lead to infarction and development of cellular edema next to the vasogenic edema. This is unlike in an arterial infarction in which there is only cellular edema and no vasogenic edema. Due to the high venous pressure, hemorrhage is seen more frequently in venous infarction compared to arterial infarction. Since many veins are midline structures, venous infarcts are often bilateral. This is seen in thrombosis of superior sagittal sinus, straight sinus, and internal cerebral veins. The most frequently thrombosed venous structure is the superior sagittal sinus. Infarction is seen in 75% of cases. The abnormalities are parasagittal and frequently bilateral. Hemorrhage is seen in 60% of the cases. These images show right frontal and parietal lobe hemorrhagic infarction due to superior sagittal sinus thrombosis. This is a typical venous infarction due to a thrombosis of the left labial vein. The CT images demonstrate hypodensity in the white matter and less pronounced in the red matter of the left temporal lobe. That is, a broad differential diagnosis include arterial infarction, infection, tumor, etc. Notice that there is a dense clot sign in the labial vein. Now let's turn to the pitfalls that mimic thrombus on CT or MR. Arachnoid granulations are small protrusions of the arachnoid through the dural matter. They protrude into the venous sinuses and may mimic filling defects caused by thrombus. Usually these granulations are easily to differentiate from thrombosis. Normally veins are slightly denser than brain tissue, and in some cases it is difficult to say whether it is normal or too dense. In these cases, a contrast-enhanced scan is necessary to solve this problem. On the left, an image of a thrombosed transverse sinus, and next to it, a normal transverse sinus. In infants, the brain is usually less dense than in older children and adults. This results in the blood in the sagittal sinus looks brighter compared to the brain, which simulates a dense clot sign. Hypopressure and apressure of the right or left transverse sinus is a common finding. It can easily be mistaken for sinus thrombosis because on the MRV, one of the transverse sinuses is missing. When you suspect that there is a hypoplastic transverse sinus, you should look at the size of the jugular foramen. This image shows a patient with hypopressure of the right transverse sinus. Let's make a summary for this session. This table summarizes the key imaging findings for detection of CVT and also the differentiation pitfalls. That's all for this section. These are useful learning resources for you to reference. Thank you.